I had osteosarcoma, which that's bone cancer. It was in my femur, so they had taken it out after like 12 weeks of chemo. They did the surgery, all was well. And then about a year ago, it had come back in my lung, but because we were doing the scans every 3 months, we were able to catch it really quick. It had barely got there. We got it out, did a bit more chemo, and I mean, I'm doing better now.
It is a bone tumor that's very common in adolescents. Unfortunately, it recurred in the lungs, which is what it does. Comes to the pulmonary beds and causes a tumor. We resected that, and then we gave him a little more therapy after that. There's actually good data for osteosarcoma that if that's the only place it comes back in the lungs, that they're still very fixable. So we're still very optimistic that this may not ever come back.
Honestly, I think the hardest part for me was just realizing, we're not promised tomorrow.
Adolescents, of course, are very challenging to have cancer because they don't want to be different. And so there's certainly cancer makes you different. From the very beginning, the lack of hair, the frequent hospitalizations, the away from your family and peers, more important than your family, your peers is a real problem. This family, however, has done a wonderful job of balancing what's important as far as real life versus therapy. We talked to them about their options, what we need to do, what we could do. He wanted to live. There were things he wanted to do. And we're just delighted he's been able to do.
I mean, everything happens for a reason, and I feel like if nothing good comes out of this, then I just wasted 2 years of my life. And it happened. I'm stronger because of it, but I don't want to just have that time be wasted. I want to see if maybe if I can help someone out, help someone who's just going through it, or families, by telling my story and being proof that it's not permanent. I've gone through it, and so can you. And I want people to know that the world's not necessarily over. It's different, and you have to go through it day by day. But don't give up hope.
There's obviously a maturity that comes from having to walk where he's walked. That I've never had to walk where he's walked. So obviously that's brought some life experience real quick.
And just getting outside, because this is the most I've done outside since we got diagnosed. So.
How are you feeling?
I'm feeling pretty good. Honestly, it didn't really wear me out. It wore him out, but I was fine.
So the last time I saw you, I guess, was 2 years ago. You were pushing your son in the St. Paddy's race. What was that day like?
That day was
crazy.
That day was a crazy day. That day was it was tough. I was so honored to be able to do that with him. But we were at a place in his treatment where we didn't know at all how things were going to go and what was happening, and we were out there because we wanted to do that.
I know what it's like to go through cancer, but I don't know what it's like to be a parent of a kid with cancer. And there were stressful times, but they handled themselves really well. And because I'm not the only kid, they had to be my parent while also living their normal lives and helping my brothers live a normal life. And honestly, I don't think I could have done it. And I think they did really well.
You used to work here. You used to be a social worker.
Yes, I was a social worker in the newborn intensive care unit.
What was the hardest part for you?
Knowing as much as I knew. Knowing what I guess they weren't saying, but knowing enough to know what they really were.
Sometimes knowledge isn't your friend.
Absolutely. He was amazing. Just amazing through the whole thing. Very practical. Let's do this. And because he's such an extrovert, he was very motivated to get better. And even with us initially, when you think cancer, it's go to St. Jude's or go to MD Anderson. Those are wonderful places, and if the particular surgeon he had was not here, that's what we would have had to do. But as far as the care he got, it was just as good. And the fact that it was so close and so convenient, of course, was good. But as far as what was offered, it's not like that we worried he missed anything. from being here. He gained so much.
We are the only children's cancer center in the state. We're the only pediatric hematologist oncologist in the state. So we take care of blood disorders, of course, and cancers. We now go to clinics in Gulfport, Hattiesburg. We, of course, have our clinic here, and we will be going to Tupelo and Grenada in the future, trying to be there where our patients need us to be. Because for many of these patients, it's a 3-hour drive to come to see us, and sometimes they're here 2 or 3 times a week.
Having Blair Batson right here, it's a blessing. Every time I drive down Lakeland and I see Blair Batson as I'm coming up to it, I'm just reminded of the blessing that Blair Batson is to my family.
A situation like this changes your perspective. You just realize, we're not promised tomorrow, and every day is a blessing. So just live life to the fullest now.